When I started the practice a dozen years ago, one of my primary goals was to make our patients feel cared about.
Every patient that comes through our door, we want them to have a positive experience.
The one thing that I've learned over these many years is it's vitally important for the physician to be a good listener. They're actually trying to tell you what's wrong with it.
And oftentimes, if you listen well enough, the patient will tell you the diagnosis, and we'll reach a conclusion together as to what we think the problem is and how we might best be able to treat it.
I take as much time as necessary in order to understand exactly where the patient's coming from, to make them understand what their treatment choices are and how I can best try to help them.
In the dance of medicine, too often patients feel that they're lost or that people aren't really paying attention to what's going on when they go to this place or that place, and we hope to solve a lot of those problems by having everything under one roof.
A legacy of trust and a future of excellence is our main motto at Argires, Becker, and Westphal.
We are trying to preserve a legacy of high-quality medical care that was started by Dr. James Argires, who started practicing neurosurgery in Lancaster nearly 50 years ago.
The main benefit that we have at Argires, Becker, and Westphal is our multi-specialty group. We're the only group of its kind in Lancaster County and South Central PA where private practice orthopedists and neurosurgeons work together.
The combination of orthopedics and neurosurgery is actually a natural hand-in-glove fit, if you will.
And someone may think, oh, my shoulder's killing me, and it may not be their shoulder. It may, in fact, be their neck. So having those guys right there to take care of the problem instead of having them wait 2 to 3 weeks to see someone else has been a real help.
One of the best things about the Argires, Becker, Westphal group is the surgeons that I work with. They try all conservative options before they recommend surgery.
In fact, I think the most difficult decision we make as surgeons is the decision as to whether or not to go to the operating room in the first place.
We have a lot of patient contact. We see patients from their most vulnerable state when they've had a fresh injury, for instance, on a sports field, and then we take them through the non-operative treatment for that particular problem, and then occasionally they won't get better with physical therapy and other modalities and will need an operation.
One of the most important aspects of being a physician is the privilege of caring for people.
The majority of patients really appreciate our efforts when they get relief and they increase their ability to perform their daily activities and they begin to enjoy life again. That's a very rewarding feeling.
Success involves getting our patients back to the lifestyle that they enjoy.
So if when my patients leave the office, they can honestly say that we have solved their problems and that they felt cared about, that would be fulfillment of my greatest ambition in medicine.
I see her back in the office in 6 weeks and she's crying. I'm like, what the heck's going on? I thought everything was going well. She goes, no, everything's perfect. This is the first time in my life I feel like a normal person. I can do everything everybody else does and I have no pain.
Walking down the street and then somebody stops and says, Doc, how are you today? You operated on me 30 years ago. You saved my life. Just wanted to stop and say thank you. That is gratification. That is a means of knowing that you've succeeded.